what they want.
Yeah.
Essentially, a lot of it's actually already detached because of the infection. How long has it been here?
Too long?
Too long?
Over a year. The right side over a year, the left side probably going on 6 months or so.
I would highly recommend that you do not let it wait for that long of time because, as you can see, this is infected.
Yeah.
And here's the bad news, and what can potentially happen is the bone can get infected underneath. So if that's the case, you're looking at IV antibiotics for multiple weeks. So don't follow. So just clip that back to the little root here. And we're gonna get our little piece that's ingrown. Wow, well, that's a good size.
I want to see.
You want to see it? All right. It's you want to take it home?
No,
You can take it home if you. Okay.
That was which side was that?
That was your left side.
Left side. Okay. This is the side I'm super excited about.
Me too. It's just like Christmas, isn't it?
Oh man.
Okay. I think you should put them in a little baggie for your wife to take home. You
No.
got a little piece that's all the way back there. It's so important to get the nail root because if any of this is left, you will definitely have reoccurrence. So anything you might see, it's typically like a nice little white shiny piece. There it is. See that? This would have been a little reoccurring ingrown toenail in that one spot. Isn't that crazy? Who would have ever thought, right? So this right here, these are called pyogenic granulomas. They are present whenever you have a ingrown toenail that's been here for quite some time. So we're gonna clip that off, kind of clean everything up. And I'm gonna use a different chemical on there to get that skin to retract back to normal. It's proud flesh. What's happening is that this is trying to push against the nail. It's trying to repair itself essentially. So the tissue just continues to proliferate and grow and grow. So then you're kind of left with these two big hunks that are right here. You'll notice they'll bleed and essentially your toenail, just toe gets bigger. Thank you.
Now, is it typical for you to have an ingrown on both sides, or do patients, I mean, is that something
Right.
they should watch for? If they have them on one side, they'll
You know
have
what?
them on the other?
The way I always look at it and say is your toenails should never hurt. So if your toenail is hurting either side, there's no really norm, there's no typical part of it. If they hurt on both sides, then both sides need to be removed. But most of the time, I'd say generally one side is ingrown. But people that have bunions, the toe presses up against the second toe, are also prone to getting ingrown toenails. So there's other, things, high heels, closed-toed shoes that are too small. That can cause an ingrown toenail to occur. We're almost done. I will tell you, the nail is quite loose back in this area here. So I'm concerned you have infection under there. Of course, we're gonna put you on an antibiotic today. But if the infection has gone underneath the nail plate itself, it may cause it to kind of come up and want to remove itself. If that's the case, a new nail will come back in that area, but just I'm feeling when I was cleaning it up, it feels quite loose, and I want to make sure you're aware of that.
That's cool. I mean,
You can kind of see
feel
the
like
white.
there's a lot of infection in there because of I actually feel pain. Well, I felt pain in the joint, whatever they're called when you bend your toe, the joints where you bend your toe.
You can see the redness coming back, and there's actually a joint right here. You absolutely need to get it taken care of. You do not want it to get into the joint itself. Because then that can cause a really bad infection. And that's what I was telling you about the bone infection. All right. And then unfortunately some people have had amputations of the big toe because of it. I don't want to scare you, but the point and the moral of the story is if your toenail hurts, then get it fixed right away, because if you've seen it's not taking long at all. Okay, pretty little package.
Awesome.